Hello, I'm Berni Machío, physiotherapist and osteopath, and in this second part of the video of interpretation of the Wecardio graph, with my partner who has been previously working on how to install and how to enter the application, let's see what happens and how to interpret the result we have. The first thing is to understand that an electrocardiogram, in the end, will be a system for measuring the nervous system through our heart. And for us, it's going to be a fundamental tool that we can have in order to be able to interpret different factors and numbers that we are going to obtain. We want to know this so that we can establish the pathology we have and above all to be able to connect with our Nesa technology. What are the important values that we can see and that will mainly give us some vitally important values? First and foremost will be the SDNN. The SDNN is a referenced value that at the level of evidence indicates that it has to be above all between 50 and 100 milliseconds, measured in that type of measurement. Below 50 milliseconds, it will indicate a metabolic inflammation. It is a value that above all indicates that we have some metabolic inflammation. That is, our electrical element, our electrical system, is able to understand much faster than other systems that something is starting to be out of balance in the body. The next measure that will be fundamental for us is the RMSSD, which is a value that will tell us the tone of the vagus nerve, how strong the vagus nerve is. It is a value to be able to know if we have to continue with therapy, intensities we can work with and, above all, how to approach post-treatment with Nesa at the exercise level, at the therapy level, etc. we can do to improve the quality of our patients. And last, but not least, is the HRV. HRV is heart rate variability. This is one of the measures, or the most evidenced measure in recent years, which is most closely related to the autonomic nervous system. The HRV will indicate the adaptability of the autonomic nervous system, how adaptable that system is to external agents and internal agents. With these three measures, we're going to be able to obtain a lot of information that we have here. This is the first part of the graph we have when we do a complete Wecardio. First, you are going to see that we have that SDNN and the RMSSD on the left side. These are the values that you are going to keep. The values we have on the right we forget for now. We keep these three values. The SDNN, in this case you have a SDNN of 47. I mean, it's a little low, but it's not all bad. RMSSD is at 36. These values are already starting to be a little lower than normal. It indicates that there is a very small or some inflammation in the body and that the vagus nerve is somewhat inflamed. The next part of the graph we are going to make and that we will be able to evaluate are all these graphical analyses that we have and that will help us to focus and make a much more visual summary of the numbers above. One important thing is to understand that this type of graphs will be useful for all patients. But with one type of patients, above all, they will not be of any use to us, which are all those who are taking beta blockers. These are the factors important patients to consider, not to perform this type of technique, or, above all, that we are not going to have very real information. And the last part of the graph is the HR, which is the heart rate variability. An important thing to know is that the number that appears in the SDNN is exactly the same as the number that appears on the HRV. This is because sometimes in the program HRV will appear below. So, in order to know what is the numerical figure of the HRV, you will have to go up and see the number that the SDNN has. In this case, as you can see, the HRV is 47, and if we go back we see that SDNN is also 47. What happens is that this 47 is not equal when an SDNN appears in front to when an HRV appears in front. To have a summary of the figures we must have and our values, we have it here. The SDNN must be between 50 and 100. If it's above 100, that's okay. It is also fine. The problem is when it is below 100. The RMSSD has to be around 50. Above, very good, and below, the lower it is, the worse it will be. And finally, the HRV has to be above 35. Then, within this, we will have several possibilities. First, most typical scenario that will happen to you, that everything is perfect, great. We know that she or he is a person who has a variability and has an autonomous state in good condition. It is adaptable. A person to work with and to improve with Nesa what is alright already. Second case, all three values are bad. If all three values are bad, they will be important factors to work with neuromodulation therapy. And a third case that will also happen very often is that SDNN and HRV are very well, but RMSSD has not yet improved. It will be mainly the prototype of patients who have started to improve, but that we must be careful with them because the tone of the vagus is too low. So, it is indicative that in the face of small changes or too rapid adaptations, for example, asking them to do an exercise faster than they should be doing it, what will happen to them? They will have a quick downturn. Here, it will be a fundamental objective to keep the therapy as we were doing it and wait for RMSSD to change and improve to be able to generate changes in both the low and high and to be able to generate changes in their therapy as well. This concludes the Wecardio training, and I encourage you to continue with the rest of the trainings on the virtual campus. Thank you very much.